Number 9 in our series of Healthy Homes sessions, lead hazards in the home. Brought to you by Indiana Healthy Homes Alliance and Improving Kids Environment. My name is Joan Ketterman, and I will be with you for this session talking about lead-based paint. As always, our definition of a healthy home: it's a home designed, built, renovated, and maintained. All of those things have to work together to support good occupant health. So we are hoping that by the end of this session, you will understand a little bit about where lead came from, how long it's been around, the health problems associated with exposure to lead, common sources of where lead exposure occurs in a property, and some suggestions for trying to maintain and reduce exposure to lead. So in 1914, this is one of the ads you could see. Will the house you built today last 100 years? Well, the Dutch Boy White Lead folks were very proud of what they had, and they said their paint was tinted any color, and it is so fine it sinks into every joint in wood par. And that means it's going to last. Well, guess what? They were right. Some of this stuff has lasted for over 100 years. So that was the good news. The bad news is we found out that this National Lead Company was deceiving us just a bit in the fact that knowing lead was hazardous to our health. And one of the other things that it reminds us is that it was, since it sank into every joint in wood pour, when people refinish their homes and strip the floors and the mantle and the doors, if wood, paint, or any other coating, so stains and varnishes, also included lead. It's not just what we think of as something that transfers color with paint. In some of our hardwood floors get stripped, even though the lead might be gone, when we start sanding, then we will get some lead dust out of the sanding of the floor, even though you can't see the coating. So even though there might not be paint or a coating, we can still have lead. Many uses over time, and most of us just think about paint and coatings. It's used in our plumbing. We've certainly heard all the stories about Flint, Michigan, and some of the other places where water and lead are the story. It was used in our fuels, which means that wherever automobiles drove by with leaded fuel, they left the exhaust would land in the yards near the street and leave a legacy of lead in those soils. Aviation is still using leaded fuels in some of its planes. It was used in pesticides. So one more thing that we were adding to our system, we were eating our fruits and vegetables, we might also be getting lead with it. It's in batteries, glazes, so there are dishes that can be found, old dishes that have been in the family for a long time, sometimes contain lead. Ammunition, electronics is still an issue, which is why electronics should never be thrown away. They need to go through an e-cycle. Mini blinds, jewelry, cosmetics, pewter. Now, many of these things you may not have in a property, but certainly something to look at. Jewelry that's designed for children that often goes into their mouth can be lead containing. It can be in crystal, and it can be in glassware that you get at your average store from Big Lots and from Walmart and some other places, if it came over from China, and they might not tell anybody that lead was used. And some medicines that came in from overseas in different cultures are places that lead has also been found. So what happens when lead gets into our system? Particularly when we talk about children, it affects the brain and the central nervous system. And since children are still developing all of the parts of their brain, it's still growing, and all of the pieces are being hooked together, if we disturb that brain under construction, then it affects IQ and begins to decrease the IQ points that potentially was available to that child. It increases the likelihood of behavioral and learning problems. It takes often several more years for these children to catch up to their peers in terms of reading. Often the person who's aggressive in school and later on outside of school, and oftentimes that can be as a result of lead poisoning. And we can't get any of that back. We don't get to go find new IQ points anywhere. Once that damage is done, it's permanent. For adults, it can also be found in kidney damage, high blood pressure, anemia. It can affect hearing. And for pregnant women, it can increase the chance of a miscarriage and harm the developing fetus before they have a chance to even get here. Why are kids especially susceptible? Well, where are they all the time up to the age of 2 or 3? They're on the floor. And what's on the floor? That's where the lead dust and other kinds of dust that we brought in from the outside are. So they then sit, put their hands in their mouth, they put their toys in the mouth, so anything that's had contamination gets into the child. They absorb more lead than grown-ups, and so a very much smaller amount can be harmful. And a blood-brain barrier, a shield to keep all this stuff out of our brains, well, it's not fully there, so it's much easier for the lead to damage the brains while children are smaller. Signs of lead poisoning. Can you look at somebody and say, oh, they've been lead poisoned? Well, no, you really can't. They're quite subtle. And often maybe a parent will be the only one to recognize they're not sleeping as well as they could. Stomach or headache, irritability, and not everyone has symptoms. Some people feel like they have the flu. But if I'd ask my 17-month-old grandson how he's feeling today, he doesn't know more than a few words, and so he's not able to tell me. So it's really up to the parent to know that they're fussy, that they're not feeling well, and express that to the doctor. And make sure that if you do go in to see the doctor, to ask for that blood test and insist on that blood test. And that anyone who lives in a home built before 78 should be insisting upon that test. Is there a safe level? Well, everyone's determined that there really is no safe level. And so if a child is tested, they're going to take a finger prick of the to test some blood, and they're going to do a screening. And if it gets to be 5 or higher, 5 micrograms per deciliter, according to the CDC, then they're going to ask for a confirmatory test. They'll take some blood out of a vein and make a more definitive decision on whether a child is considered to be lead poisoning. Included with that will be some education about things they can do to reduce exposure through a risk assessment, and that's when the health department will come out and hopefully identify and give you some examples of ways to reduce the source of exposure. And that's available to everybody in the state. Most health departments will allow for testing. Doctors' offices should be testing. Medicaid pays for testing, so making that suggestion to everyone who has small children is certainly helpful. If a child is as high as 45, then that becomes an emergency and often a hospital stay to get those levels to lower. So we don't want to get to those numbers. The more testing you do, the sooner you do it, the better off the child is. Paint manufacturers were not allowed to keep lead in paint as early as 1978. Turns out if the home was built before 1940, at least 68% of those homes were going to find lead on the inside or the outside on any original paint that's in the home. Once you get to 1940, that number began to reduce. In 1960, more homes were built using water-based paints as opposed to the old-fashioned oil paints. Lead was never found in those paints, and so that number certainly gets lower as time goes on. That doesn't mean that somebody doesn't have it, and doesn't mean that you shouldn't test. just the likelihood goes down as the homes become newer. And lead is in the paint can also cause lead in the dust. And for a lot of children, they're not eating the paint chips, they're putting the dust that's created from the lead paint into their hands, into their mouth. And so that can be a problem from both inside and outside. Chipping, peeling, flaking paint and dust, all of those are signs that testing should be done on the paint. It can be found on any painted and, remember, coated surface, but more often you're going to find peeling in rooms where there's excessive moisture, like a bathroom or a basement, or outside in the exterior exposure to the elements. Also places where there's a lot of impact, walls, doors, stairs are places that you often find peeling paint. Lead dust is often created at points of friction. So as windows go up and down, they create lead dust. It lands into the trough and onto the sill. And children love to stand there and look out of the window, to play in the windows. It's a great place to take your cars and move them around. So that lead dust can be hazardous to the health of the child that wants to play there. Oftentimes you'll see cracks and chips and a scaly or an alligatoring, and this is indicative of old paint, and most old paint is lead paint, and so that's certainly something that we suggest you test. Now your health departments can come out and do testing, but you can also buy just a regular type of test that can be done by a homeowner, and most hardware stores carry those, but the health departments are available to help. If you suspect the testing and you want to do it yourself, that's the easiest, simplest, fastest way to do it, but hiring a professional or asking your health department is the way that we recommend. If you think there is lead in the property and you don't want to wait, or if you know lead through testing, until remediation can take place, clean up the chips and or flakes using wet methods, not a broom, microfiber cloth, a Swiffer, and institute hand washing several times a day, especially for the children, and especially before they eat and put their hands in their mouth. If you're going to do some remediation, then you see the logo here. Everybody that comes in to work on lead or disturb paint and not knowing if it's lead should be a lead safe certified firm. You can look at the epa.gov/lead, epa.gov/lead website, and look for the term certified firm, and it lists the over 1,000 firms in Indiana that are have taken the class and are approved to be firms. What that means is that they should be using lead-safe work practices. They should be using wet methods. They shouldn't be leaving any dust. They should be putting plastic down on the floor when they do the work. And if you have any questions, you can call your health department about that as well. If it's in the water, well, up until the 1930s, it was used in pipes that deliver the water. And then after that, it was used in the pipes that would come from the system, the utility system, up into your house. And those were often lead pipes. And it depended on the community when they stopped doing it, 60s or 70s. Until 1988, was used as solder for copper pipes, so it's also found in homes. And since that time, they've been lowering the amount that would also be in our plumbing fixtures, but it's easy to find in the house. So if you do nothing else, if you flush the water out before you drink it, run it for 10, 20 seconds, that's one way to, the immediate lead that's available, that's one way to make sure you don't get any of that. There are anti-corrosive chemicals that keeps most of the lead from leaching, and your water company or your utility is required to use those. What happened up in Flint is that they stopped using those chemicals, and that's why they got into the problem that they have. According to the EPA, many of our public water systems, serving 32 million people, were found to have lead levels exceeding the safety standard. Now, 15 parts per billion is the number that they use to determine if something has to be done about that lead in water. It is not a number that was picked because it's going to help in our health. So even if your water system's below that number, doesn't guarantee that there's no health concerns. Find out if you have lead pipes, if you can dig up and look, or you call your water company. You can have your water tested, even though the utility company does that. It's a simple thing to do. You can replace the pipes and the fixtures. Many communities are now going out and trying to figure out a way to make that happen. The simplest thing for any homeowner to do is to install a filter and change that filter on a regular basis. Lead in the soil. So outdoors, as time has gone on, from the paint as it chalked into the soil next to the property line and near the street where the leaded gasoline settled, and lead naturally occurs in soil as well. And if you know that you live in an area or your clients live in an area that's somewhere near where factories used to be, there's been lead smelters in several places throughout the state, including East Chicago, then that lead will have settled into the soil and it doesn't go away. It's like a rock that settles and still there many, many decades after it's settled in. And of course, if the paint chips or flakes or chalks near the house, then that adds to the soil burden as well. And in some places, even homes, if you had an underground storage tank to provide gas to heating, then that was a place, if those leaked, could be a problem as well. As we said, lead is naturally occurring. Indiana, it's nothing that's like in some of the other states where lead was produced. Contaminated soil, though, does come from many other ways. And so the easiest thing to do for a homeowner is to cover it with 6 to 8 inches of gravel, of mulch, of some other kind of material that'll protect when people continue to use that area. Ceramics, if it says on the bottom not to be used with food, then that should be a clear sign not to be used with food. But those things that are have been around for a while, gifts from people in the Caribbean and overseas, then maybe it should not be used for eating, particularly with children. Jewelry, you can look at it. It can be tested with an easy kit. Your health department can help test it, or just take it away from the children if you're not sure. People who work with stained glass, who work with bullets, make their own lead sinkers, work with old lead furniture, all can be exposed to lead through the various parts of heating it up or sanding the paint. If there's a poisoned child, then the health department is going to get that information immediately from the lab, and they will come out and do a risk assessment, so an investigation, and from there they will hopefully detect what the causes of the lead are. In some cases, the simplest thing to do is to move into a house that might already be lead safe. The landlord then will get the information as well when the health department comes out to do an investigation, and hopefully the landlord is not going to use that against the tenant, but we've known that that has happened sometimes as well. State law requires landlords to provide housing that we can live in, that they would live in. Means it has to have heat, and it has to have running water, and it has to have paint that's in stable condition. And so oftentimes the health department can issue a citation to the homeowner and require that they fix those things, especially those that are causing exposure. Not everything comes from the house itself. Sometimes it's about the people in the house helping to manage the causes. And so it's a two-way street. Both groups have to work to keep the house maintained and keep the threat away from our children. And as we mentioned, we certainly want to have lead renovators who know what they're doing, who are certified. So if you're getting new windows, if somebody's getting their house painted, if they're getting repairs made, then doing that correctly minimizes the amount of lead dust. Incorrectly increases poisoning chances for our children. Anyone who lives in a property built before 1978, disclosure is a required federal law. And what that means is that you will get a pamphlet called Protect Your Family that says there may be lead in the house. Unless they have a document to prove there's no lead paint, then they must say that the possibility exists and give you that information. You would sign a piece of paper. And if that hasn't been done, then the US EPA can take actions against that landlord. And on their website, epa.gov/lead, there is a place to talk about that to the EPA and submit the complaint. Federal law requires contractors to warn occupants if they will disturb paint in pre-1978 housing. Again, a pamphlet that gets signed to say that they told you that they're going to do some work that might disturb paint. And Indiana also says that if work is going to be done in a pre-1960 home, that the contractors have obligations to make sure they do not leave lead dust behind. Thanks for listening. More resources can be found at lead with EPA, epa.gov/lead. HUD has a program. We have some information on the Indiana Healthy Homes Alliance as well. And I hope you'll have a good day and have learned something today. If you have more questions, feel free to look on the website, the Indiana Healthy Homes website, or to call the office, or call your local health department as well. Thank you.